Hi, everyone. Thank you for joining us tonight. We are here for the seminar regarding childcare during COVID-19. Thank you for joining us once again. And my name is Nora Melendez, and I am a parent leader in Head Start and in various other places that, I love to be involved in my community. And my children have been in the Head Start program pretty much since birth. For two of them, I have three, all under the age of 5. And my 5-year-old recently started kindergarten. And my other two are currently in the Head Start program in East Palo Alto. So, I've been very concerned, as I'm sure a lot of you are, which is why you're here. I've been concerned about COVID-19 and, the symptoms and the effects, and how dangerous is this, is COVID really for myself, my family. There's a lot of information out there, and it's hard to keep track of, on top of everything else that we're working on or worried about in today's life. And so we've gathered several experts on the subject and on the current regulations for San Mateo County. So the purpose of the day, or this webinar today, is to answer your questions about how to keep your kids safe at preschool and during this pandemic. And so I would love to introduce, first off, for our opening remarks, Superintendent Nancy, to give us a little introduction into the evening.
Great, thank you so much, Nora. It's so good to be here tonight, and thank you, Nora, for all you're doing in your leadership role to help our families and our children stay safe and move forward. I am Nancy McGee, and I'm the County Superintendent of Schools, but I'm also a mom, and I'm soon to be a grandma. And my daughter-in-law actually is an assistant director of a preschool. And she has been open in her preschool since COVID-19 hit in February, March. They went down to very small numbers at first, and everybody wore masks and practiced all the safeguards. And they've done marvelously well at keeping everybody safe. They haven't had to close any cohorts at all. And all of this time that she did this, she was pregnant. And so now we're going to be bringing in a little baby into our family. So I just want to say hello to all the parents out there. I know how concerning it is sometimes when you're just not sure if it's the right thing to do to take your children out into the community. But I think you'll learn tonight that we have really very solid practices that you can all adopt for you and your family and your children. Your children can learn them. And I think I think COVID-19 is going to be with us in our communities for a while, maybe a few years. So we really do need to learn how to move out of our homes and be safe and make sure that we get to work, that our children get their education, and that we do it safely. So I'm so happy to have this event tonight, and I thank all the panelists, all the hosts of the event, First Five and the County Office of Education and the 4 Cs and Parent Voices and IHSD. I don't have the flyer in front of me. I'm probably forgetting someone, but just welcome. Buenos noches, and let's get the party started. Back to you, Nora.
Thank you, Superintendent McGee. So just going back to the interpretation aspect of tonight's webinar, if you would like, if you need interpretation to Spanish, just check the interpretation little globe at the bottom of your screen. So you will be able to listen in to all the information that you'll be getting tonight in Spanish as well. So we'll now introduce our speakers or panelists for tonight. Jill Vandroff, and who's a school nurse at San Mateo County Office of Education. Dr. Neil Patel, a pediatrician at Palo Alto Medical Foundation, as well as Donna Uriar, project specialist for the state's preschool program at San Mateo County Office of Education. Dr. Anand Shabra, who's medical director at SMC Health. Welcome, everyone. So I'd like to start off with Dr. Patel. How is childcare safe during COVID?
Greetings, everyone. Thank you so much for having me. I'm Dr. Patel, and I currently work at Palo Alto Medical Foundation as a pediatrician. Greetings to everyone. Hola a todos los padres. So I am a medical advisor to the San Mateo County Pandemic Recovery Framework. I have been working with Nancy McGee and many of other really wonderful people in the community who are trying to help us stay safe. I'm also a representative for the American Academy of Pediatrics and also a First Fight Commissioner. And I thank them for helping me to get involved with this conversation. But I want to share with everybody that my most important job is to be a father to two boys who are age 11 and 13. They attend school in Redwood Shores in the Belmont Redwood Shores School District. And like many of your children, they are at home 100% distance learning. And I'm asked every day at work whether it's okay to send our kids back to school or to daycare. I first want to let everyone know that this conversation doesn't have a simple answer. There are many things to consider when deciding on childcare and whether it's safe to go back. There are a couple of things to consider: age of the child, the type of daycare, the ability to wear a mask, the ability to hand wash, the number of children that are in the daycare, the ability to practice physical distancing. All of these things are important. And finally, it's an important promise that all of us parents have to take to not send our kids back to school when if you have sent them back, to make sure that they are healthy and not having any symptoms or sick when they go to school. Childcare has been open throughout this pandemic. So I want to point out that for essential workers, people have been sending their kids to childcare or to daycare since this whole thing started. Childcare providers have had the most practice on how to stay safe and still have kids in daycare. There's a couple of things that we seem to know. We know that the younger the child, the fewer number of kids are infected in a population. The risk seems to increase with age. Of course, we still are learning a lot about coronavirus and COVID, but there is a difference between a young small child and an older child, such as a teenager. Any childcare provider must provide a safe environment that will help us to follow the basic rules for COVID safety, whether it be a home-based daycare or a center-based one. But I'm going to go through the pillars or rules for safety in just a little brief detail. So the number one thing is wearing masks. The American Academy of Pediatrics and we as pediatricians, we have found that children age 3 or older can wear masks. They will wear masks if we encourage them. We have to teach them. we have to model it and wear them ourselves. And I've seen little kids come into my clinic with their masks on, really actually doing it much better than adults. They can wear them for long periods of time safely. Masks are one of the most important things that we can do to prevent transmission of COVID. And it does not cause harm to children to wear it for a long period of time. It may not be easy, but it can be done and is important. The next thing is washing hands. So frequent washing of hands and making sure that we minimize the touching of lots of different objects over and over again that are shared with other individuals is important. And daycares, I think, are aware of that and try to minimize the amount of touching of objects. The third thing is staying 6 feet away. Even though this is hard perhaps for a child, and we know they don't always stay 6 feet away, it's important that we do this as much as possible. So the things that you would see in a daycare or a childcare setting is stations being set up 6 feet apart. And if you can't stay 6 feet apart, because children are children and they will not necessarily stay 6 feet apart in a daycare, we hope that they wear masks so that they can actually be closer if they need to. And lastly is minimizing exposure to a large number of people. And that sort of means that trying to minimize the size of the classroom. That is a complicated question also. There is no one answer that a childcare facility, or it depends, that should have a certain number of kids. It depends on the facility and how well we can do the other things to stay safe, such as wearing masks. There are things such as, you'll hear the word cohort. And by cohort, we sort of just mean that we want to try to have the kids and adults exposed to the same people. And if we can't have them be exposed to the same people, then again, we want to have to try to wear masks and do different things so that it's okay to see some other people. I do want to talk about, and those are the 4 things. I do want to talk a little bit about testing, and we're going to hear more about that, I think, later today. But testing is not as easy to get as it is for adults. But I do want to know, and you will hear that the San Mateo County now provides testing for children greater than 5 years of age, where the cost is either billed to the insurance or it's free. And if you have a child who is younger, then it's important to call your doctor. And as a reminder, I also want to remind everybody to get the flu shot this year. I know the flu shot is not always something that we want, or the doctor doesn't force you to take the flu shot. But this year is especially important because we can't always tell the difference between the flu and COVID. So it is important to try to do all that we can to make sure that we don't get the flu itself. So nothing is perfect. I want to be clear to everyone that children can get COVID. And they can pass it to other people. But from what we know, it seems to be that adults give it more to kids than kids giving it to adults. But it can go both ways. So it's important to listen to the experts and to make sure that the infection rate in the community is low enough. The best thing to do is practice the safety measures. Some of them that I mentioned is the best thing that you can do to stay safe. And lastly, I want to share with you all, even as a parent, I feel this. It's hard to know what is the right decision, and thinking about these things can be scary. But if we're smart and we take precautions, then we can get kids back in childcare. Because remember, it's really important for their education, for their social development, for their growth. And as always, you have a big team of people who are very dedicated to you and your children to help you figure this out and to help you be courageous to keep going. So, and I think our kids deserve it. So that's my opening statement. And I thank you all for listening and for having me here.
Thank you so much, Dr. Patel. We really appreciate your comments and information. We'll turn it over to Jill and Donna in just a sec. I just wanted to remind everyone that if you have questions that come up while you're listening to the panelists, please use the Q&A feature if you haven't sent in your questions already. So Jill and Donna, would you go ahead, please?
I think we need our slides.
Yeah, our slides. There we are. Hi, everybody. I'm Jill, school nurse for San Mateo County Office of Ed. And I just want to thank you for inviting us to talk to you tonight. And thank you to all the people who worked on this program, and to Dr. Patel in particular, who is always inspiring me and giving me good ideas for what to talk about when I'm talking with everybody. So thank you so much. So tonight, Donna and I hope that this presentation will help you to learn about health and safety practices in childcare, and also to build understanding and support during COVID-19. Those are our big overall objectives. So the 4 pillars, everybody, Dr. Patel already talked about it. Here's the graphic that we're using in schools. You've probably seen it already, especially if you have students who are in K-12 education. And this is nothing new. Everyone in California is already following these guidelines that we're doing this to protect ourselves and to protect others during the pandemic. And I just want to also thank all the residents of San Mateo County for doing a good job with this and helping us in San Mateo County to progress from the purple to the red, now to the orange tier. So we're doing a good job as a community in keeping the spread of COVID down. And so thank you for that. And one way of looking at all these strategies that we have is through these 4 pillars. And so we're just going to review it more. Dr. Patel already touched on them all, but experts do believe that if we follow these 4 pillars, like Dr. Patel said, in childcare settings, that we can really significantly decrease the spread of COVID-19 when our students, our kids are at childcare or at school. And the 4 pillars are health and hygiene, face coverings, physical distancing, and limited gatherings. So we're just going to talk a little bit about the different, in a little bit more detail than Dr. Patel did, about these different pillars. So pillar 1, health and hygiene. This is just a huge pillar. It includes a lot of things, including staying home when you're sick, the #1 thing. And then right after that is screening. So screening means that when your child or any staff member arrives at childcare for the day, they get screened. That means they get their temperature taken, they answer certain questions. And you might have already actually experienced this when you maybe had a medical or dental appointment and you showed up and they took your temperature and they asked you questions about if you had any symptoms of COVID. This would be the same process. Not only are we going to do that, but staff are also trained to monitor the wellness of the kids throughout the day. So if somebody appears to be ill during the day, then that's also something that we're looking at. And then there are protocols for what to do when a student might get sick during the day, such as isolating them away from others, and also for what the protocols are for picking sick children up from childcare. Also in health and hygiene is good hand washing. We talked about that already. Soap and water for at least 20 seconds. And it should be done frequently throughout the day at childcare. It's encouraged to be made part of the daily routine. So for example, it would be when you show up for childcare first thing in the morning, you would wash your hands. After toileting, wash your hands. Before and after eating. When you come in from playing outdoors, or when there's a lot of messy play. So there are a lot of times during which the hand washing would happen throughout the school day. Hand sanitizer can also be used if soap and water are not available. We have to be careful with hand sanitizers. Be aware they are drugs. Children under 9 years old actually need adult supervision to safely and effectively use hand sanitizer. So the hand sanitizer that's provided in your program should be the one that your child uses throughout the day. And methanol-based hand sanitizers will not be used, and you shouldn't buy those either. Another way to sort of limit the spread through health and hygiene practices is limiting personal items. So that means staff and students alike should limit the amount of personal items that they bring into childcare for the day. If you do bring something in, then those items will be labeled and put in separate bins, and then also cleaned and by staff appropriately at the end of the day. But if we can limit the items, then there's less to clean and less germs to share. Another element of health and hygiene is good ventilation. So that means using outdoor areas as much as possible, using open windows and doors when practical and weather allows. If you have ventilation systems, that they should be put on settings to decrease the recirculation of air, and filters of ventilation systems should be upgraded to the best possible. Also in the health and hygiene, giant pillar is cleaning and disinfecting. And we're going to cover that in another slide that's coming up.
All right, so one of the things we had talked about, Jill mentioned, was that staff and children are all screened upon entering each day, and staff monitor the wellness of children throughout the day, taking temperatures, visually doing checks to see how they're feeling to make sure they're monitoring that. But let's watch an example of what an arrival screening process looks like in one of our local childcare centers here in San Mateo. The sound doesn't seem to be on.
We lost our PowerPoint.
Good morning. Welcome to preschool. Glad to have you guys with us this morning. How is everybody doing? Good. Do you want a foot pump or do you want a welcome wiggle? Wiggle. Which do you want? None? It's okay. Well, good morning. How's everybody doing? Good. Good. We're going to do a health screen before you enter it. We're going to have you sanitize your hands and then sign them in. Okay. But before we do that, we're going to do our health screen questionnaire. Okay? Does your child have any cough or shortness of breath? No. Does your child have any fever in the past 24 hours? Has anyone in your household tested positive for COVID-19? Okay. All right. I'm going to take his temperature. Wonderful. Your body temperature is normal. While you're waiting for the next family, this is where you wait. Make sure you wait 6 feet apart. Okay. Would you like to wear a mask today? No? You want to wear your own mask? No. You want a new mask? Want a new one? Okay. Cool. You can give that to Mama. You want to look like a doctor? Yeah. Good job. Thank you.
That was a nice video of just what it might look like or what to expect as children and parents arrive to a child care facility every day. So we also talked about cleaning and disinfecting. And so in order to decrease the spread of COVID-19, surfaces need to be properly cleaned and then disinfected. So cleaning helps remove dirt and some of the germs in the surfaces, while disinfection uses chemicals to destroy any germs on the surfaces. So we first clean and then disinfect. And many programs use soap and water to clean and then a solution to disinfect. Most surfaces and objects just need that normal routine cleaning, but in all childcare programs have guidelines about cleaning and disinfecting, which include having a regular cleaning and disinfecting schedule throughout the day and at the end of the day, which includes sink knobs, toilet handles, door knobs, and tables throughout the day. And some programs have even designated a staff member who's responsible for that, routinely cleaning and sanitizing and disinfecting the classrooms and the sites throughout the day. Programs will often designate a container for toys that may need to be put to the side and cleaned, whether they've been mouthed or have gotten dirty. There might be a designated container for removing those, especially with younger children, with those infants and toddlers. Toys in the environment are easily to clean and disinfect. And those hard to clean items are generally put away, such as stuffed animals, dress up clothes, because they're harder to clean. Those are put away right now. And easy to clean materials are out in the classroom and environments. A program might have multiple toys and manipulatives accessible for children. And oftentimes they might have individually labeled bins with toys or those sensory items to allow for some Play-Doh and sand play, but it's more of an individual for that individual child, is not shared. Toys that may be put in a child's mouth should be cleaned and sanitized regularly. And we also, between groups of children, or those cohorts, like Dr. Patel said, between different cohorts of children, those outdoor play equipment and structures are disinfected between groups of children. Childcare facilities use approved disinfectants that are on the end tool for COVID-19 disinfectants that are US EPA approved to be effective against COVID-19. Again, you know, children are not using these disinfectants, and they at all times should be out of the reach of young children. So, and face masks. So all adults in the childcare facility are required to use a face covering while at work or in the family childcare home in proximity to young children or the childcare space. No face covering should be used for people less than 2 years old, and those who cannot remove the face covering on their own or have medical reasons why they cannot use one. A face covering is recommended for all children 2 years old through 2nd grade and are required through 3rd grade and up. But you know, with modeling, with teaching and explaining, we noticed most young children are willing to wear that face mask, like Dr. Patel had mentioned. Children are encouraged to use those face coverings during outdoor activities. However, it's not required, it's just highly encouraged. Face coverings are not, of course, required during eating and drinking. And when they're not used, they should be kept in a separate and clean space, either in their cubbies or in a paper bag away so they can stay clean when not on a child's face. And we always use those clean, well-fitting face coverings and replace soiled or wet face coverings throughout the day. And we may have noticed that in the video we just watched that the face covering was a little loose that the child had. The face mask was loose. However, we just wanted to make sure to point out that it is very important to make sure they have a properly fitted face covering.
Okay, so pillar 3, physical distancing. This is another very important way that we can decrease the spread of COVID-19, and that is by maintaining 6 feet of distance from others. Here's a good example of tape being put on the floor to help children understand where the spaces are and how to create smaller groups and different groups. And so even smaller groups of 2 or 3 can be made into these taped off areas. And then also the whole concept of cohorting, which we're going to talk about in the next slide, the whole group as a whole. Also, furniture can be rearranged to promote distancing, including the markings on the floor, as I said, and also the cubbies for storing the personal items. Napping cots, mats, cribs should be placed 6 feet apart, head to toe. And if a program or a family childcare home has limited space, 3 to 6 feet is also an okay distance. So you've probably heard this word, cohorts. This is one way to promote physical distancing. And a stable cohort means a single group of children and adults who stay within their group for all activities. The actual size of the cohort is determined by the ability to implement physical distancing within the environment. So if you have a really tiny space, your cohort might be smaller. And if you have a very large space, cohorts may be a bit bigger. But there are limits, and programs still must follow the required child-adult ratio that is mandated by their licensing agencies. So the aim of creating the cohort is to reduce mixing of group members with other groups. So this allows for practical and necessary considerations. And it also ultimately helps with contact tracing. If there is a case that comes up, then we know exactly who was in what room at what time. It just really helps a lot in that way. And if for some reason a cohort is broken and somebody comes into the cohort, it's okay. We'll just fall back on all the other pillars to give us strength. So if somebody comes in, then we want to make sure that's not in the cohort for some reason. We want to make sure that that person is wearing a face covering, washes their hands before interacting, and maintains physical distancing. So that's how we layer the strategies to create safety. Okay, pillar 4, limited gatherings. Limited gatherings means avoiding large-scale events that bring people from different groups together. This is the bummer. No parties, no food sharing. You know, that's our life now, but these are really important ways that we can limit the spread of COVID in our childcare settings. No outside visitors. If you do have outside visitors, there should be a protocol that states how the outside visitor is screened when they come in and how they're to behave once they're there. The other important point is if a child needs specialized services while they're at childcare, such as speech and language therapy, that is actually okay, that is allowed. And that person, that specialized service provider, will be screened according to policies and procedures of the program. And then if it's a district program and they're a district employee, they would follow their district testing guidelines. And also any specialist that comes into the classroom or the setting, the childcare setting, must follow the 4 pillars, just like everybody else who comes into the classroom. Especially now, the holidays are upon us. Please follow this in your personal life too, away from childcare. And I just want to say that there are travel and holiday guidelines that can be found in various places. Right now on the SMCOE website, the CDC website, and the San Mateo County Public Health Department website. So there's lots of guidance about how to have a holiday celebration that is safe, so that when we come back to childcare after, that everybody is healthy.
Yes, so policies and procedures. So every childcare program should develop a COVID-19 specific policies and procedures handbook and communication for parents and staff. And in addition, before a childcare program may reopen during this time, community care licensing will visit virtually each program to verify what are the plans in place for following COVID-19 health and safety protocols, and to verify that the program is ready and is following the 4 pillars. They have a plan in place and what they are doing, what postings are posted, and how the environment's set up to just ensure they're ready to receive children. Staff and families need to be trained on these specific plans and know what to do for health and safety. And those program policies are based on many local, state, and federal guidelines. Guidance includes children who intend center-based childcare as well as family childcare homes. And then with communication, we want to make sure that communication is strong between the child care facility program and parents, and it's key to running safe, effective child care programs. So we want to make sure that as a parent or guardian that you read the program's parent handbook and communications in order to understand the guidance and expectations to keep the facility safe. We ask that parents and guardians immediately report any child or family illness to your provider. Please report any exposures to positive COVID cases immediately to your provider. And then if you happen to be out sick, maintain good communication with your program while your child is out and until they return. And so the many authorities that have created guidance for safe return to childcare and school include the San Mateo County Public Health Department, which is our main local source of guidance, the California Department of Public Health, Center for Disease Control, California Department of Education and Community Care Licensing. And preschool and childcare programs must follow all of these guidance, and the guidance is updated frequently. However, a program can always apply stricter interpretation of guidance that best meets the needs of their program and the community. All right.
Okay, thank you. Thank you, everyone, and thank you, Jill and Donna. Now we'll move on to the question and answer portion of the webinar. The first question that has come up is, should we expect the incidence of infections to increase over the winter months?
Hi, Nora. I was going to share a case study first.
Yeah, I think if you could do it really quickly. I was informed that we might not have time for it. But yeah, please go ahead.
Okay. So I'm Dr. Chabra with San Mateo County Health, and I have had the privilege of working with IHSD over the last number of months. I've not worked with them for many years, but particularly around the COVID issue. You know, they have had 24 classrooms open for the last 3 months. So we've had lots of opportunity to modify protocols and learn from the guidance from lots of the other entities such as the CDC, the California Department of Public Health, and of course from San Mateo County Health. With, you know, that many classrooms open, you would expect that, you know, it would not be surprising to have some cases of COVID among children or among teachers. And we have had a small number of those at various IHSD sites. But the good news is, because of the strong protocols in place, none of these infections have resulted in an outbreak. So while one individual in the classroom became sick, they didn't spread it to anyone else in the classroom. And that's because of the great screening protocols, you know, the stable cohorts that you've heard about, the cleaning and the mask wearing. And so, you know, what happens when a child tests positive in a classroom like this is the classroom is usually closed for 2 weeks. That's what happens in most cases, so that the exposed children don't infect someone else. And with these measures, we've, again, really not seen any outbreaks of COVID, just individual cases. So while you can't guarantee that there won't be any cases in a childcare setting, you can definitely prevent, you know, the spread in a classroom setting with these careful activities. And I think IHSD is a great example of that. Thanks. I'll pass it back to you, Nora.
Thank you once again, Dr. Chabra. I'm glad we didn't skip you. I apologize for that. So yes, please, let's move on to the questions portion. And I'll repeat my previous question. Should we expect the incidence of infections to increase over the winter months? Dr. Chabra or Dr. Patel? If you could
Yeah, this is Dr. Patel. I'll start with the question. Sure. Over the winter, it would be reasonable to think and at least be prepared for cases to rise. One of the things, as many of you might know, in the rest of the nation, cases are rising. And we think that happens partly just because people are going out more. And as we become more stable, then people are tempted to go out. Our kids are going to potentially be going back to school more, so cases may rise. So the answer to the question is that it is a possibility that it could rise, and we're monitoring this closely. In either case, I think it's really important that you have to be very careful. And whether cases rise or don't rise, in both cases, you need to be really careful, because if the cases are stable, it is because everybody is practicing safe, is being very safe about about taking the precautions. And if the cases are rising, then even more reason to take the precautions. Nanda, Dr. Chhabra, I don't know if you have anything to add.
No, I think you covered it well.
Thank you, Dr. Patel. To our second question, can children ages 2 to 5 wear face shields instead of face masks?
Why don't you start that one, Dr. Patel?
Yeah, I'll definitely comment on that. So for age 2 to 5, the recommended face covering is a mask. We think that masks work better than face shields. One thing from a practical way that I will say is that we don't really find that children are able to use face shields very well, particularly in the 2 to 5 age group, and that masks actually work better. And this is, to be clear, greater than 2 years of age. So the general recommendation is to use face masks over a mask or a shield. Sorry, face masks over a shield.
And I'll just add that while some people will use both a face covering as well as a face shield, like Dr. Patel said, the face mask or face covering is really the preferred and expected thing, except in very specific situations where for some reason a child is unable to wear that, or in specific learning environments. But really we're expecting a face covering rather than a face shield.
Great, thank you both. So for either of you, Dr. Chhabra or Patel, is there a mandatory quarantine guidelines, or are there mandatory quarantine guidelines if families travel or partake in social gatherings?
That's a good question. In terms of travel, at this point, there is not a mandatory guideline. I think a child care center certainly can have their own policy around that, and they may wish to have a policy, but there isn't a national or statewide or countywide quarantine just based on traveling somewhere. International travel used to have an expected quarantine period. Now it's really based on an individual situation. And what was the second half to that one again?
That was it. Thank you so much.
Okay.
Thank you. Dr. Patel, are there any known side effects to children after they have been infected with COVID?
So in terms of known side effects, generally we think that children recover well from COVID. Many of you might have heard of a condition, multi-inflammatory syndrome, where kids can get fevers and sort of very sick some time after they recover. So there is a possibility. I can tell you that the incidence, the likelihood of that happening is very low. And we're still learning a lot about it. And from what I know, the children who do get that, if they get the proper care, which thankfully many kids in our area do, they do well and recover from that condition. You will hear a lot more about side effects in adults that, and many of them, that seem to affect children less or don't affect them at all.
And there've only been about 100 cases in the state of California of the multisystem inflammatory disease in children. So it is a very, very rare event, those areas.
Okay, thank you. Yes, thank you both. Now, does a negative test, negative as in negative for COVID-19, does that replace the need to go into quarantine at all?
So I'm assuming this is if someone was exposed to someone else who had COVID-19. If you're exposed, you have to do the 14 days of quarantine, and a negative test does not shorten that 14 days.
So at a practical level, it may be helpful to reassure a little bit, but it does not, as Dr. Chabra said, eliminate the need for quarantine for 14 days. We have to have that level of safety to make sure that things stay safe in a school setting.
So this would be, the next question would be about ventilation. How do ceiling fans or central heaters affect the spread of the virus?
I think the most important thing is if you have a central system, is that the settings are not on recirculation, but they're set for outdoor air. And that you, so that's the main thing about the settings, other than upgrading filters.
That's a very good question, or very good point. Now, playgrounds, outside playgrounds, is it necessary to sterilize the playgrounds between cohorts of children?
Yes, part of the guidance is for that program and hard materials, to playground structures to be disinfected, bikes, trikes, things that children kind of play with. Some programs have sanitized balls and those types of things with a disinfectant between the cohorts.
I do want to mention, as part of the answer to that question as well, is that as the schools and daycare and childcare centers are doing their best to make sure that the playgrounds are cleaned in between play, it's really important to teach our kids to really hand wash after any sort of activity where they may have touched something or exposed. This question will come up with going to the bathroom as well, right? So just in the same way that normally we would have our kids wash their hands, and now especially again after they use the bathroom, if you happen to touch something or go to the grocery store or go to the playground where children have touched something, that would be a case where sort of outside of the school setting, for either outside of the school setting or in the school setting, use hand sanitizer or wash your hands with the warm water for 20 seconds. That would be a great way to prevent the spread, and also make you less worried about whether you've been exposed.
So do kids need to wear masks outdoors?
For childcare, oh, go ahead, Dr.
Go ahead, no, please, go ahead.
For childcare, it's highly recommended and encouraged. However, it's not a requirement. So they absolutely do not want it. We don't force any child to wear their mask.
Right. And obviously it's, there's less chance of spread outdoors than there is indoors. So that's the reasoning for that.
And I think from my end, it again goes back to if you feel your child's at risk. So if you are outdoors, but then you're going to be around a bunch of other people who are outdoors, as well. And if they're not a part of your cohort or your bubble, then then it would be advisable to wear a mask, even for children.
Great. Now, can you speak to precautions or risks or special circumstances for children under age 2 who can't wear a mask?
Children under age 2 should not wear a mask.
And I'll take that a little further. I think so. Maybe also perhaps part of the question is to be, how can you keep your children who are less than 2 safe? And generally speaking, I think that when you're less than 2, you are, most families in my experience are minimizing the activity that would put them at risk. So for instance, a lot of times children less than 2 are not really, we're not thinking about sending them to preschool. Now they may go to childcare, but a lot of times they're being protected in different ways at home. My best example of that is a baby, and a baby will be in a car seat, and parents are very careful with their babies. And they don't have, baby doesn't wear a mask, but the entire car seat is covered with a blanket, which in a way serves the purpose of a mask. It's not the same thing, but parents tend to protect their children less than 2 in pretty effective and maybe different ways.
Thank you, both Dr. Patel and Dr. Chabra. Should we be more concerned about high-risk family members in the home, such as grandparents or pregnant moms? What are your recommendations for special populations?
Well, I mean, I think it's really important to be thinking about, family members who might be particularly at risk, whether it be grandparents or other elderly members in the family, whether it be pregnant women, where we know that there is a slightly increased risk of complications if they get COVID. So I think every family is going to have to make those decisions individually, but I think they want to keep that in mind and think about who are the at-risk members and how can they minimize the risk for the people in the household who might be at greater risk.
Yeah, I think I agree with that you obviously, in those particular situations, you try to minimize the risk by avoiding or delaying, say, going to childcare. But let's not forget the powerful example that we started with Nancy McGee and her family. I believe it was her daughter-in-law who was actually running the daycare. And that is, again, all about the precautions that you can take. Right, having said that, we in healthcare are seeing people who are sick with COVID, and we take precautions like wearing protective equipment and masks and gowns and all the different things to make sure that we don't get exposed ourselves. So one of the real clear messages that I think that I would like to send is that yes, we need and we should be very thoughtful about what situations we put ourselves into, but depending on what our situation is, we can mitigate, we can actually make sure that we're careful through the precautions that we've talked about today. They are very effective.
And just recognizing that some people cannot avoid certain group situations, whether it be childcare or other things, sometimes it's a necessity, and so you minimize the risk in other ways.
Do we have any information about transmission rates off of different surfaces?
Oh.
There's actually a lot of information out there. I would say it's not necessarily always practically helpful. Certainly there is some risk of transmission from surfaces, but it seems to be much, much less than transmission face-to-face, in-person contact, or, you know, shaking hands or hugging or coughing on someone. That seems to be much, much more significant than what happens with surfaces. Still important to clean surfaces, but that's probably not the most important thing.
Okay, great. And so one last question. If someone was exposed to COVID, but they themselves tested negative, is it safe for that person to go out in public knowing that they're negative?
Like we said before, if they were actually what's defined as a close contact of someone who's COVID positive, they need to quarantine for 14 days. There really is no exception to that, just for everybody's safety. I think you're on mute, Nora.
Sorry about that. Thank you, everyone, for your responses and the information. We'll close out now. We're making good time, and parents, you can find more information for any questions that you might not have had answers for tonight. Please look at, go to the websites for the CDC, San Mateo County Office of Health, and the County Office of Education as well. We'll be posting the video for this webinar on Facebook, as well as those websites that I mentioned. The FAQs will also be available via Facebook, social media, and the websites. And the material will also be posted in Spanish. So once again, thank you everyone for your attendance. And I hope you have a great evening.
Thank you, everyone.